Opioid Overdose Prevention and Response Training, a project of the San Diego LGBT Community Center and A New Path. Training details: LGBTQ and substance use facts, local opioid overdose statistics, about opioids, recognizing and responding to opioid overdose, how to contact emergency medical services, how to use naloxone. 28% of LGBTQ youth reported experiencing homelessness or housing instability at some point in their lives, and those who did had 2 to 4 times the odds of reporting depression, anxiety, self-harm, considering suicide, and attempting suicide compared to those with stable housing. Fewer than 40% of LGBTQ youth found that their home to be LGBTQ affirming. 41% of LGBTQ young people seriously considered attempting suicide in the past year, and young people who are transgender, non-binary, and/or people of color reported higher rates than their peers. 56% of LGBTQ young people who wanted mental health care in the past year were not able to get it. 60% of LGBTQ young people reported that they have felt discriminated against in the past year due to their sexual orientation or gender identity. 814 fentanyl-related deaths in San Diego County happened in 2021. That number rose to 815 fentanyl-related deaths in San Diego County in 2022. Over 108,000 people died of an opioid overdose in the United States from February 2021 to February 2022. Opioids can be natural or fully semi-synthetic, entirely man-made drugs. Opioids diminish the perception of a reaction to pain. They also produce feelings of euphoria. Heroin and some prescription medications, such as morphine, fentanyl, oxycodone, codeine, methadone, and buprenorphine, are all opioids. Opioids bind to an active receptor in the brain, triggering the release of dopamine, a neurotransmitter linked with learning, pleasure, and reward. Over time, opioid use changes both the amount and sensitivity of dopamine receptors in the brain, leading some people to restore dopamine levels by continuing their drug use. Types of opioids: heroin, fentanyl, morphine, oxycodone, Vicodin, hydrocodone, Percocet, and codeine. A very small amount, 2 milligrams, can be fatal. Pharmaceutical fentanyl was developed for pain management treatment of cancer patients applied in a patch on the skin. While Mexico and China are the primary source countries for fentanyl trafficked directly into the United States, India is emerging as a source for finished fentanyl powder and chemicals. It is often cut into counterfeit prescription drugs sold on the street. It is now showing up in many street drugs, including cocaine and methamphetamine. Other names for fentanyl are Fetty, Fetty Wap, Apace, Blues, China White, Dance, Dance Fever, Fent, and Fenty. If you touch fentanyl, it can be removed from skin with soap and water. Alcohol-based products such as hand sanitizer or wipes may increase fentanyl absorption. Powdered fentanyl does not penetrate the skin very easily, but avoid touching lips or eyes. Ingestion is how you overdose. Carry naloxone and fentanyl test strips and be familiar with it for your clients, loved ones, or partners. Naloxone is a prescription medicine that reverses an opioid overdose. It cannot be used to get high and is not addictive. Naloxone is safe and effective. Paramedics and doctors have used it for decades. Naloxone is also called by the brand name Narcan. Naloxone is an opioid antagonist. The brain has many receptors for opioids. Too much of an opioid fitting into too many receptors slow and stop the breathing. ODs can be instantaneous or over a longer period of time. ODs can happen as a process. Someone slowly stops breathing. They usually happen 1 to 3 hours after the drug was used if a person is actively using, whether it be licit or illicit. With fentanyl or carfentanil, it can happen instantaneously. With new users, it can be instantaneously. Risks for overdose: mixing drugs and using without medical supervision. Benzos are common in opioid ODs. Uppers and downers do not cancel each other out. Mixing opioids and stimulants actually increase risk for overdose. High dosages of opioid use. Tolerance changes, resumption of opioid use after extended period of abstinence. Using alone. Change in dealer, product type or purity, and the method of taking. Concurrent medical conditions. Naloxone has a stronger affinity to the opioid receptors than the opioid themselves. It knocks the opioid off the receptor, allowing the person to breathe again and reverse the overdose. Identifying an opioid overdose: blue or purple fingernails and lips, unresponsive to voice or touch, pinpoint-sized pupils, slow heartbeat or low blood pressure, pale, clammy skin, slow, irregular, or stopped breathing. You've seen enough to be worried, now you check on them by tapping their foot, asking if they're all right or are you okay, saying something alarming. If no response, try a sternum rub. Rake your knuckles across the person's breastbone hard. This is enough to wake them up if any pain is going to wake them up. If still no response, proceed with OD recovery procedure. Please note, if the person is experiencing another form of medical emergency that is not related to an opioid overdose, naloxone will not harm them. Call 911. Administer first dose of naloxone. Place into either nostril and plunge. If no response, administer second dose of naloxone. Rescue breathe if your supply of naloxone is depleted. Wait for emergency medical services to arrive. The California 911 Good Samaritan Law under California law states that if you witness an overdose and call 911 for help, you are protected. It shall not be a crime for any person who in good faith seeks medical assistance for the person experiencing a drug-related overdose to be under the influence of, or to possess for personal use, a controlled substance analog, or drug paraphernalia. The person experiencing an overdose is also protected from these offenses. Responding when they come to. Let them know what has happened. Explain that they have overdosed and you administered naloxone. They may be in withdrawal from the naloxone. Stay with them and monitor their breathing, and inform them that naloxone wears off in 20 to 90 minutes and the opioid is still in the body. The overdose can come back once naloxone wears off or if they use again too soon. If paramedics are not coming, person should visit a doctor as soon as possible. They could have fluid or vomit in lungs or have other medical complications. What happens if you use your naloxone or Narcan? If it gets used, tell your prescriber. There is no punishment. You get new doses of naloxone. Naloxone is available at the pharmacy over the counter without an outside prescription if you and your loved ones want additional doses. It is also available at all San Diego County Health and Human Service agencies, with other local organizations including NAMI San Diego, Harm Reduction Coalition of San Diego, Say San Diego, and Mental Health Systems North Inland, and many more.